COVID-19 pandemic. What it is and ways to prevent the spread. What is COVID-19? COVID-19. It is a severe respiratory illness which is caused being infected by the coronavirus named SARS-CoV-2 or severe acute respiratory syndrome 2. The picture to the left presents the long-lasting effects of the disease. SARS-CoV-2. Severe acute respiratory syndrome 2 is a novel coronavirus that we are currently struggling right now, and it is cause of the disease, COVID-19. The picture to the right displays an illustration of the virus and its given parts. Transmission of the virus. There are two known ways the virus can spread from person to person. Droplet transmission. Whenever an infected person coughs or sneezes, they release little droplets, and when close to others, they might unknowingly get infected, touching objects that have been contaminated with the virus. A healthy person may be at risk when they touch objects that have been used by others who are already infected, then touch their eyes, nose or mouth afterwards. Infection of the virus. When the virus has entered your body, there are many things it could do. When the virus finds a cell, it injects its genetic material to make more copies of itself, which proceeds to infect more cells. The infections get even more severe as they go down the respiratory tract. It is possible that it can cause more respiratory problems such as bronchitis and pneumonia. When the virus reaches the lungs, it causes inflammation in the alveoli, where oxygen and carbon dioxide gets exchanged. If this happens, the alveoli may experience swelling, decreased airflow and filling of liquid, causing shortness of breath and difficulty breathing. Appearance of symptoms. There are numerous symptoms that can signal that you are infected. Note, not all symptoms will be mentioned. Common symptoms: dry cough, fever, tiredness. Serious symptoms: difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Be aware that it takes 5 to 6 days for symptoms to show from when someone is infected with the virus. Ways to prevent getting infected. Prevention is better than cure. We must decrease the number of people who are getting infected, and here are some of the protocols we must follow. Safety measures to prevent the spread. For times like this, it is essential to be cautious and prepared. Maintain your distance from others, for about 3 meters away. As how the virus spreads is through droplets, so it is really encouraged to keep your distance from others to decrease the risk to getting infected. Always wash your hands with soap and water. Research shows that washing your hands with soap and water or with an alcohol-based solution can destroy the virus. Regularly clean and disinfect frequently touched objects. This is to reduce the risk of contaminating others, since it can be spread on objects. Always wear a mask and a face shield. This serves as protection from the droplets from another person, and to prevent you from touching your face. When you are feeling unwell or observe some of the symptoms on yourself, stay at home and seek medical attention if the symptoms are severe. And while COVID-19 can be very deadly, the vast majority, in around 80% of cases, are mild to moderate and patients recover for a week or two. The whole world is currently finding a cure or a vaccine for the coronavirus, so we must try our best to help them by following protocols and safety measures to achieve this. That is all. Thank you. I hope you find this video very helpful.